We've all been there. You walk into a room and forget why, or maybe you spend 10 minutes hunting for your car keys before finally finding them in a drawer. As we get older, our brains naturally slow down a bit, taking longer to learn new things or temporarily blanking on a familiar name is a normal part of aging. Sometimes memory issues become more frequent, to the point where they show up on medical tests or cause minor hiccups at work. Doctors call this mild cognitive impairment, or MCI. A person with MCI might rely more on lists and reminders, but they are still able to live independently and manage their daily lives. Dementia describes a point where memory and reasoning struggles become so severe that a person can no longer safely live on their own. This is a broad category, an umbrella held up by several distinct physical diseases happening inside the brain. To understand why a person is losing their memory, acting differently, or having trouble speaking, we have to look past the general term and identify exactly which disease, which specific spoke, is broken. Alzheimer's disease is the most common cause of dementia, representing roughly 60 to 80% of cases. While scientists are still studying the exact why, they know how the disease physically damages the brain. Over time, physical deposits of a protein called beta amyloid build up into plaques between nerve cells. Inside the cells, other proteins twist into disorganized tangles. Together, these plaques and tangles choke off the brain's healthy neurons. The early signs of this damage are gradual and subtle. A family member might start repeating the same stories, or asking the same questions, or suddenly getting lost in a neighborhood they've lived in for decades. As the damage spreads through the brain over years, the symptoms become much more disruptive. A person will struggle to find the right words. Their personality might shift toward anger or deep apathy, and eventually they will lose the ability to perform basic daily tasks like paying bills, bathing, or eating. Alzheimer's physically erodes the landscape of the brain. It steadily disconnects a person from their skills and memories, requiring families to step in with increasing levels of day-to-day care. Other causes are common as well. Vascular dementia, for instance, results from a plumbing issue. When blood vessels in the brain get clogged with fatty deposits or damaged by strokes, the blood flow gradually slows down. Parts of the brain are starved of oxygen and eventually die. Different forms of dementia affect entirely different systems. Lewy body and Parkinson's disease dementia cause abnormal proteins to form in areas controlling movement and sleep. Patients often experience physical stiffness, vivid hallucinations, and a tendency to physically act out their dreams while asleep. Frontotemporal dementia, or FTD, targets the front and sides of the brain and tends to strike at a younger age. Because of the location of the damage, the early symptoms rarely involve memory loss. Instead, families notice drastic personality changes, inappropriate social behavior, or a sudden inability to understand language. For people over the age of 80, it is very common to have mixed dementia, where both Alzheimer's and vascular damage are present at once. The brain can also be damaged by outside forces over time, such as chronic alcoholism or repeated head injuries from contact sports. Every brain disease leaves a different footprint. The specific behaviors and timeline a family will face depend entirely on which part of the brain is being damaged. There is no way to predict with total certainty who will develop dementia.
Advancing age remains the biggest risk factor. The condition is rare before age 60, but affects almost half of all people over 90. Genetics also play a role. Some carry a specific genetic marker passed down through families, making the disease more likely, though it is not a guarantee. While you can't control your birth year or your DNA, you can build cognitive resilience. Keeping your blood pressure in check, staying physically and socially active, and using hearing aids or glasses to stay connected to your environment all help protect your brain function. These daily habits don't erase genetic risks, but staying broadly healthy helps build a mental reserve, delaying the emergence of severe symptoms. Identifying the specific cause of a person's decline requires a broad search for clues. Doctors combine cognitive tests with blood work and brain scans to look for the specific damage patterns that identify the disease. Once a diagnosis is made, the conversation turns to medicine. Traditional pills can help boost communication between nerve cells and manage memory symptoms for a while. However, it is a hard medical reality that they do not cure the disease or stop the brain from slowly worsening. Recently, new therapies given directly into the bloodstream, intravenously, have been approved for early-stage Alzheimer's. These medications are designed to physically clear out the amyloid protein plaques to try and slow down the disease's progression. This medical text from UpToDate outlines a critical warning for these new therapies. They carry severe risks, including swelling and bleeding inside the brain. Because of this danger, patients must undergo regular MRI scans throughout their treatment. The emotional weight of the disease, the agitation, anxiety, and personality shifts is often more difficult to manage than the memory loss itself. To address this, doctors strongly prefer using behavioral therapies and established daily routines over heavy psychiatric medications, which can cause extreme confusion and falls in older adults. Medicine cannot stop the storm completely. However, a tailored plan that balances safety, symptom management, and gentle routines can keep a person comfortable and improve their quality of life. Protecting that quality of life means making hard choices early. Driving is often the first safety issue families face. Because dementia damages reaction times and spatial awareness, every person with a progressive dementia will eventually reach a point where driving is too dangerous. This is a painful loss of independence, but the conversation must happen early. Inside the home, caregivers must step in to prevent physical danger. This includes removing loose rugs, disconnecting gas stoves to prevent fires, and setting up GPS locator apps on a phone or bracelet in case the person wanders away. If you are caring for someone with dementia, your communication style has to shift. Keep nighttime routines calm and consistent. When your loved one expresses mistaken facts, try to gently change the subject rather than arguing. Trying to convince them of the truth usually just triggers frustration and anger for both of you. It is vital to establish a power of attorney and a healthcare proxy while your loved one can still participate in the planning. And if you are the primary caregiver, you must protect your own health. Seek out local support groups and use adult daycares or respite services to give yourself a regular break. A dementia diagnosis is overwhelming. We don't yet have the tools to stop the rain, but by identifying the specific diagnosis and building a strong safety plan, families can weather the storm together with dignity.